before I go on, I'm a pediatrician as compared to obstetrician, and there is two fundamental changes between obstetricians and pediatrician. Number one is that we go off by distraction very, very easily, unlike obstetrician who can work in a very noisy environment. So I'm going to ask design master crew to keep quiet on the corner here, because they were very destructive on the first session. The second thing that pediatricians don't like to be doing, unlike obstetrician, is to be told that they have a specific time, because we give all the privilege for children to play, and we'd like to play. So don't remind me of my 5 minutes, if you don't mind. I'm just kidding about the second part, but I was very serious about the first part, is that we are very, very distracted by noises and others. I'm not here to instruct you. You are more grown up than I am. You are an obstetrician, I'm a pediatrician, so you do have the superiority. I'm here to provoke your thoughts about medical educations, and I would like to thank the organizing committee, the scientific committee, to make an effort to put a session in this scientific conference about medical education, and we do encourage all others to put that in mind. If you care about your specialty in near future, you should care about medical educations, because we are invading the way, and we are putting our nose in every single specialty and how they shape their specialty for the future. So you have to accept us as a medical educator for the future if you care about your specialty in the future. So paving the way to learners in practice. And as much as I'd like to talk to a physician, we do understand in health system, physicians only make 3% of overall health system forces. Is that figure is right? The percentage of people who make health system in any country is not a physician. There are way more other importance and players in the game, in the health system, that are more meaningful to the patient, who's the ultimate target of any health system. Physicians are a small percentage of that. That's why I would refer to the word learners. We need to learn together as a physician, nurses, obstetric practitioners, and others, because ultimately we have to make our patients happy. You can make the most genius obstetricians, very well-trained pediatrician and neonatologist, yet they are a very, very, very small percentage when it comes to health system delivery. Society do not care about who's the most responsible person who's a physician. They do care about the quality of service they receive, and they see quality from the whole continuum, from the parking lot to the discharge paper they deliver. You can provide them the best service ever, but if the discharge process at the end of the 5 minutes of their experience was wacky, then the entire process is gone. We need to learn to work together and learn together. You've heard the word change, and I would like to call it the 3C model, the continuous change cycle. If you want to maintain to be in a practice as a medical educators or obstetricians or a pediatrician, whatever, you have to accept change. And why is that? Is that because we would like to change? No, because we are forced to change by our target client, which is patients. Patient expectation change, patient's knowledge exchange, patient information change. So ultimately, we have to change to serve the client, which is the patients. When you are ready for the change, get ready for another change too. And actually, more intelligently, you have to make change, a structure change in your environment within your own system, where the only constant part of the formula is change. We're changing tomorrow. And nobody can teach you change better than those constructor workers on the way to work to maternity hospital or NBK, where they tell you how to divert your way every day differently. I never gone to my work to MBK hospital over the last 2 years in one constant way. There's always an alternative way of going on it. Leaders cannot be successful at the bringing about change if they don't understand change dynamic. And here is where most of the struggle. Over the last few years, working either here or observing leaders when I was trained, I have seen a very, very intelligent leader. However, none of them had completed their mission. And the reason is that they did not understand the dynamic of change. So they failed at one stage of that, which I will explain and go over. What goes on the mind of the profession, the employee, the citizen, the patient, and ultimately their own mind? There is no worse than telling the learners and others that you don't know where you are going in the next 5 years, 10 years, and 15 years. The only reason why the US presidents get elected because he knows from day one of the campaign where he's going to take the United States in the 50 years to come. And when he makes this very, very clear to the public, he knows where he's taking the United States citizen in 50 years. He get elected, although he doesn't know where he is taking them in 4 years. But he's so assertive about it that everybody follows him for 4 years because he tells them that he's very, very assertive, that he's going to take them the way he wants to take them in the next 50 years. So where do we fail in bringing changes? These are the people's reaction to change. If I tell you that I'm not going to continue my talk, I'm going to stop here, and I'm going to leave the podium, you will have a reaction. You'll be shocked because you would think that I was invited as an elegant speaker to talk to you, and now leaving the podium all of a sudden, that's not nice from somebody who holds the title like me. You will deny it. He'll say, Maitham will never do it. I know him very well. And you'll be very angry because you've left everything to sit here and this guy now is moving away. And then you'll say, oh, if you could stay for 5 minutes, maybe you can leave earlier and so on. And then you feel depressed. And then you say, it's okay, let him go. The next speaker is going to be more engaging, which I believe he is. He's a very good speaker, the one who's coming after me. And then you accept it. That's what happened to people. Those leaders of change, they need to do 2 things. They need to make this part much more smoother as a slope. You should not let people drop to the bottom here. You have to make this slope as smooth as possible and this line close to straight as possible, taking them from the shock to the acceptance in a very smooth way. That's number 1. Number 2 is you have to make the line, the space between these 2 lines, shorter and shorter. Everybody will accept change. But it's no good if you accept the changes after 10 years. We want you to accept the changes within 6 months. That's our target. Our target is 3 years. Our cycle is 2 years. We are in office for 1 year. Most of the chair of departments hold their office for 2 years. So unless they make these 2 lines closer to each other and the slope is even more smoother, they will not achieve anything in 2 years. Can you imagine a chair of department or a program director or head of institutions who's going to deal with a denial and anger and depressed people for 2-3 years? They will not accomplish anything. So they have to make it shorter, they have to make it more smoother. And we have to develop a strategy by which we can deal with angry people and depressed people and know how to bargain people of where they reach to do. Leaders need to do that part of their leadership. I told you that I know a lot of leaders. What I don't know is a lot of people who can take the mind of those leaders and become a good manager of the change. To do a change is not a wish. You don't wish to go to the Alps around 3,500 meter height. That's not a wish. There are steps that you have to take. And unless a leader comes with a team of good managers, if the leaders does not come with a group of good managers who can translate his wishes into goals and objectives, they will never reach their goals. And these are the steps where leaders need to bring in. We need to make everybody in a hurry, in urgency. We need to tell them, if you don't change in 2 years, system will eventually do. And this is what the people in accreditation tells you, that the deadline for accreditation is 2 years. We have to change. It's very urgent. We have to move on in the couple of few months in order to get accredited or whatever. You need to work with a lot of people. And when I say a lot of people, it's not only people sitting beside you, it's everybody, including your patients, hospital directors, chair of department, chair of councils, at Ministry of Health, and others, because they will help you facilitate the change. You have to create a vision. It's only a very short period of time. Everybody's going to antagonize you. Everybody's in denial, angry and depressed. So if you don't know what's your target, you'll be lost. You will be off target very, very soon because you'll be easily distracted by others. You have to tell people what you want to do. And you have to empower them to do the things you are willing to do. Because, again, it is what you do is going to make things happen. It's not what you say and what you wish. And then you have to create a quick win. Because we often comes in office a very short period of time. We need to get a trophy at the end of the day. That will make us happy and go on. The worst you can think is a financial incentives. A lot of business model that has been built on financial incentives had failed. People will just ask for more money and more money. So don't make this as a win. Build the change, build on the change, and make it stick. So make it part of a system. I had a short discussion with Dr. Adler just recently. Change is not about you change X person to a Y person. That's not a change, because the Y person will be changed by the Z person in 2 minutes. It's about creating a criteria and system by which X person and Y person get selected. And that way, you are changing the system. In order to create change, you need to build a team.
Dr. Maitham, you have 2 more minutes.
Sure.
Thank you.
And this is what you need to do. You need to have a clear, measurable goal with a clear role that is communicated very well. And again, you have to resolve all the conflict, depression, anger, and denial at once. So KIMS is asked to lead the post-grad medical education by the Emiri Decree. It's the only mandate in the country that leads post-grad medical education. So they have to create the vision. By leading the improvement of the society's health through specialized medical training and education. The only power that was given to KIMS is education and training. There is no other power in the Amiri decree other than this. We cannot enforce policies, but we can train people. That's the only power. And if you believe in training and education, then you can stay with KIMS. If you think, like public health, believe that you have to enforce policies, then you go to public health and not KIMS. So we had to build the strategy. And these are the 3 strategies that we had built. Excellence in medical education, organization practices. Again, the entire organization have to flow with the change. Optimizing the organization structure for effective organization practices and communication. Update and develop organization policies and procedures. Achieve national and international recognition for KIMS as an institutional post-grad education office, and to develop and monitor key performance indicator of how we are doing. And then we have to standardize the training that is done. Again, training was done in a very, I shouldn't say non-systematic way, but differently in different programs. And to achieve a mission, you have to standardize things. And then again, the word of the century is a quality improvement. The word of the last century was evidence-based. The word of this century is a quality improvement. So we had to inject a quality improvement in the process. In order to make the change, again, as I said, it's the organization, it's the learners, it's the faculty and the curriculum, and this is the organization that we are building. It's the board of trustees that put overall goals and objectives. The KIMS is run by the Secretary General, and he needs, as a leader, to be augmented by 3 specialized committees in order to work and introduce change, such as the Accreditation Committee, Policy, Appeal, and Credential of Training. And offices that again can manage the process of change from a mission and goal to rather a clear objective. And our key person in the hospital is the program director with his post-grad training committee. We have introduced KIMS Care, which is Conference on Advanced Residency Educations, where we had introduced key concepts for physicians such as patient safety, quality improvement, research, and so on, so that would expand the vision of future physician, because this is what they need to practice in the future. These are some of the workshops that we have introduced, including those related to health information, from a very basic to very advanced, patient safety and physician competency, focusing on teamwork and communication that are very important in the practice. So what's next is to prepare for the next change, because going from a standardized teaching is not the end. The world is changing now to competency by design that we have to prepare for it as we are implementing the previous change. Thank you very much.